Hello and welcome to Fact Files as we continue our conversations with those on the front lines of treatment with coronavirus patients across the country and understanding what they are doing at this point, updates, and of course the kind of treatment path that they're following. I'm joined now by Dr. Rajan Nanda, Principal and Controller Rajmata Vijay Rajesh Scindia Medical College and Associated Group of Hospitals from Bhilwara in Rajasthan. Now, Bhilwara made news in a manner of speaking because it was on 8th March that a 52-year-old patient suffering from pneumonia was admitted after 5 days later, that patient passed away. And since then, Bhilwara has textile city has had several cases now totaling over 26. So let's get an update on where things stand and also how many of the patients have been cured already and what's really been helping them. Dr. Nanda, thank you very much for joining us. So give us an update on where things are at this point in Bhilwara.
Till today, only 26 patients came positive or admitted. So not from last 3 days, we are not having any positive cases in the Bhilwara district. We are sending around about 300 tests per day to be tested to laboratory at Jaipur. But from the last 3 days, we are not getting any positive, no more positive case from the last 3 days. So the situation seems to be going better.
Right. Now, you were also one of the earliest areas or districts to impose a lockdown. So is that what is working, or your thoughts on what could be helping you if it is at this point?
Lockdown is working, and home-to-home survey done by our survey teams, RRT teams, and we have covered almost 30 lakhs public of Bhilwara district, including 5 lakh public of the city and the rest of the public around the rural areas of the district. So the survey has been done, and the potent for the infection cases have been identified, and their samples have been sent. Around about 2,000 samples till date we have sent to the laboratory for checking.
Right, and amongst the 26 that have tested positive, could you tell us how many are in hospital, are all in hospital, and within hospital, what stages of treatment are they?
Out of 26 patients, 22 were admitted in Bhilwara, and 4 were admitted at Jaipur SMS Medical College.
Okay.
Out of 4 in Jaipur, 2 patients have turned from positive to negative, and 22 patients admitted in Bhilwara. 11 patients have turned from positive to negative. Of course, 2 patients have expired, but they were sick and having other morbid diseases like kidney and hypertension. Though they were positive in the coronavirus test, but it seems that their deaths were not due to coronavirus, maybe due to the associated high comorbid diseases.
Right. So now you said 11 patients are negative. So these 11 are now out of the hospital?
No, we have tested them. 2 tests have come negative. We have made a step down sort of thing for them, step down ICU for them. They are in the hospital, and after they are completing 14 days, we will getting another 3rd test to be done. If that also comes negative, then we will be sending them to home.
Okay. So now, so therefore you have 22. So another 11 patients now still under active treatment?
No, I have told that 2 patients have passed away and 9 patients are under active treatment now.
Sorry. So 9 patients under active. So could you tell us about those 9 patients? I mean, what stages are they in right now?
They are improving, and we will be sending tests tomorrow of some of the patients for confirmation that their report is negative or positive.
And what is the broad age profile of these 9 patients?
They are below 60.
Okay. And are they all from Bhilwara, or are they and is there any other travel history? Like I remember you had one patient who was from Philippines.
No. They are from Bhilwara itself. Actually, the process started from one of the private nursing homes in the Bhilwara. So most of the patients either are related to that nursing homes, doctors or the treating nurses, and some of the contact person have also come positive.
Right. So now, amongst these 9 plus 11 patients, what is the treatment path that you've adopted?
We have given antiviral drugs like lopinavir, ritonavir, and drugs used in swine flu. oseltamivir, and we have also given azithromycin antibiotic and chloroquine for the some and other supportive drugs like antacids and those things we have given. We are giving a good nursing care in those isolation wards and plus these medicines.
Right. So, would you say that this combination of these medicines and, of course, the care is largely working, at least with those patients who are maybe more healthy or do not have
Yes,
prior?
yes, this is working. This is the pattern which we have followed from the SMS Medical College. They have already converted 4 or 5 patients from positive to negative, and we got the guidelines. They have tried this in SMS Medical College because the first patient in Rajasthan came positive, was admitted in SMS Medical College, and they did the trial, and we are following the same guidelines which the SMS Medical College is following.
Right. So I did interview Dr. Sudhir Bhandari a few days ago. So I have I do have a sense on how the treatment was handled at SMS. Now, what are the lessons that you feel we have learned from what you have seen in Bhilwara in the last 10 days or so, or 15 days?
I think the isolation of the suspected or the affected patient is very important. So we are having a patient who goes for a test. We keep them in isolation till his report negative or positive, whatever it comes. Then we shift him to the respective ward or the home quarantine or home isolation, whatever the things are.
Okay. Is there, I mean, when I say experience, I mean, when you look at the past, you talked about treating with swine flu medicine or drugs that are used to cure swine flu. Are you seeing anything in the symptoms today? I know all the symptoms are known now to everyone, that you can relate with something in the past, and in that sense, to that extent, your experience is helping you better understand or manage.
I think it's too early for whole of the world to understand what is the pathogenesis or what will be the progress of this virus will be in the future. Let us wait till the findings from whole of the world comes, and for the better mankind. We will have to wait. But I think this treatment is working, and this should be tried.
Right. And how are people, patients, or I mean, people who are not patients? I mean, overall in the district of Bhilwara, when obviously you've gone in for an early lockdown, you're implementing very strictly as a district. How are people reacting? Are they welcoming this?
No, people are welcoming, and they are quite cooperative. From 3rd onwards, our DM is posing a strict curfew in whole of the city, in whole of the Bhilwara district. So for another 10 days, there will be a strict curfew in the Bhilwara, and it is better because we will be passing from the 2 cycles of the coronavirus. 2 cycles we will be passing. If we will able to pass these 2 cycles successfully, I hope that the problem can be sorted out, at least in Bhilwara.
Right. One question on hospital capacity. Now, I did read that 5 private hospitals have been taken over by the government. So could you tell us about how many beds are there today in anticipation of a rise in cases and the total capacity?
We have made designated 200 beds in the MG hospital of the Bhilwara. They will be used whenever, if there is any outburst of the situation. Secondly, we have acquired 5 private hospitals, got in contact with the 5 private hospitals. So we will be increasing capacity to somewhere 650 in case of any accidental outburst or something wrong happens with the society. We can accommodate these cases, about 650 patients in the Bhilwara.
Right. So you're saying that you're ready to take 650 coronavirus patients if there were so many patients. I mean,
yes.
And that's the extent. So does that mean that hospitals are operating at what would be about 30% capacity currently then?
No, as such, if I say of MG Hospital Bhilwara, there is no other government hospital available in the hospital in the city of the Bhilwara which can accommodate other type of patients, because regularly other type of surgical or non-surgical emergencies are coming to the hospital. We have accommodated those patients are like pregnant women. We have to accommodate children, pregnant women, those also. So we are having 520 beds in MG hospital, we are not sparing all of the beds for the coronavirus. We are sparing only 200 beds for the coronavirus patients. And
Right,
rest of the
yeah, but you said you have
rest of
650,
the
so the other 450 are
will be in private hospitals.
right. Okay, and last question, Dr. Nanda. So as from what you've seen and from what you've achieved in terms of curing so many patients, what is your message to those who will watch this and who are watching and particularly as a lesson from a district like Bhilwara in terms of how to prepare for a coronavirus infection in future?
I will suggest the public that the directions given by the administration, follow the directions. Don't be afraid of the coronavirus. Report if you are having any influenza-like symptoms. Report to the hospital immediately. Don't be afraid that you will be kept in isolation for 14 days after you are sampled. So if the sample report comes negative or positive, you take the treatment accordingly, and by this your life or the life of the public will be saved.
Right. Dr. Nanda, thank you very much for joining us, and I wish you all the best for your efforts and your colleagues in Bhilwara. Thank you so much.
Thank you.